All right, today we are diving into something truly incredible, renal transplantation. And look, this is so much more than just a surgery. It's this amazing medical journey that literally gives people a second chance at life.
So what does it actually take to replace a vital organ? I mean, think about it. We're talking about a mix of mind-blowing science, some serious logistical puzzles, and this constant delicate dance with the human immune system. That's the core question we're tackling today.
Okay, so here's how we're going to break it all down. First, why this is such a game changer. Then, who actually gets on the list. We'll get into the nitty-gritty of finding that perfect match, take a peek at the surgery itself, and then, what happens after? What's life like post-transplant?
All right, first up, a life-changing solution. So let's just jump right in. Why would anyone go through something this complex? Well, the answer is pretty straightforward, and honestly, it's powerful. It is absolutely life-changing.
You see, a successful transplant, it's not just a patch-up job. It's more like a reversal. It can actually undo some of the damage from kidney failure. And, this is huge, it gets patients off the grueling, relentless cycle of dialysis. Imagine that freedom. No more strict diets, no more crazy lifestyle limits. And the best part? The success rates are incredibly high. We're talking about a real shot at getting back to a normal life.
Okay, so who gets this second chance? It's not so simple. There's a really thorough evaluation process to figure out who is and who isn't a candidate for the list.
So, this whole journey really kicks off with a diagnosis of something called end-stage renal disease, or ESRD for short. Basically, this is the point where the kidneys have just stopped working. Now, there are a bunch of reasons this can happen, but the number one cause is something called chronic glomerulonephritis. It's a mouthful, I know, but it's basically a long-term inflammation of the kidney's little filtering units. At this point, a transplant isn't just an option, it's often the best way forward.
Okay, this is where it gets really interesting. How do they decide? Well, you can think of it in two buckets. On one side, you've got the absolute no-goes, the deal breakers, things like an active cancer or really severe heart or lung disease. The surgery itself would just be too dangerous. But then on the other side, you have what we could call potential hurdles, things like morbid obesity or, say, a history of not sticking to medical advice. These don't mean an automatic no, but there's serious issues that have to be sorted out first before a transplant is even on the table.
So, you're on the list. Now what? Well, now the hunt begins. And this is not just about finding a kidney, it's about finding the right kidney. This is the critical process of finding that perfect match.
When it comes to getting a new kidney, there are basically two avenues. First, and this is the gold standard, is a live donor. A family member, a close friend, someone who can donate one of their kidneys. This is preferred whenever possible because the kidney is in top shape and usually starts working immediately. But for a lot of people, that's just not an option. So they go on the national transplant waitlist for a kidney from a deceased donor. These are absolutely life-saving, but sometimes the kidney needs a few days to, wake up and get going after the surgery.
So how do they do it? How do they find this perfect match? It all comes down to something called HLA typing. Okay, stick with me here. Basically, all of our cells have these little protein markers on them called human leukocyte antigens. The goal is to match these markers between the donor and the recipient as closely as possible. I love this analogy of a biological lock and key. It's perfect. The closer the match, the better the key fits the lock, the less likely it is that the body's immune system will see the new kidney and go, "Hey, you don't belong here," and attack it. Now, for deceased donors, things are broken down a bit. You've got your standard criteria donors. These are kind of the ideal scenario. They're under 50, no history of things like diabetes or high blood pressure. But here's the thing, the demand for kidneys is just so high. So they created a second category, the expanded criteria donor. This could be someone over 60 or maybe in their 50s with a couple of risk factors. It's a way to make sure more life-saving organs are available for people who desperately need them.
So, why all this work? Why all this meticulous testing and matching? It all comes down to preventing one thing, one absolute worst-case scenario: hyperacute rejection. This isn't a slow burn. This is an immediate, all-out attack by the body's immune system. We're talking minutes, maybe hours. And the scary part? It's untreatable. So every single test is designed to make sure this just doesn't happen.
All right, we've found a match. Now it's time to head into the operating room. This is where it all comes together in what is truly a surgical masterpiece.
Okay, here's a little bit of trivia that blows most people's minds. You'd think they'd take the old failing kidneys out, right? Nope. Most of the time, they just leave them there. The new kidney gets a brand new home down in the lower abdomen, in a place called the iliac fossa. Why? Well, it's just a much better spot to hook it up to the big blood vessels and the bladder.
And here are the 4 main steps of this incredible procedure. First, prepping the kidney. Fun fact, they actually prefer the left kidney from a donor because it has a longer vein, which makes it easier to connect. Then they place it in its new spot. And after that, well, it's basically the most high-stakes plumbing job you can imagine. They have to connect the donor's artery and vein to the recipient's big iliac vessels. And then the final piece of the puzzle, connecting the ureter to the bladder so everything can flow. And to make that plumbing job even safer and more secure, surgeons have this really clever trick up their sleeve, especially for deceased donor kidneys. It's called a Carroll patch. They leave a tiny piece of the donor's aorta, the main artery from the heart, still attached to the kidney's artery. This gives them a bigger, stronger cuff to sew onto, which is a brilliant little innovation that makes a huge difference in preventing complications later on.
Okay, the surgery's done. Huge success. But for the person who received the kidney, a whole new chapter is just starting. This is the reality of life after the transplant, and it's a marathon, not a sprint.
So, let's talk about the big challenge, rejection. This timeline breaks it down really well. You've got hyperacute rejection. That's the immediate one we just talked about, the one all the testing is meant to stop. Then, in the first 3 months or so, you have acute rejection. This is actually the most common kind. And finally, there's chronic rejection. This is a much slower process that can happen over months or even years, and it's a lot trickier to handle.
Think of your body's immune system as this super vigilant security team. It is always on patrol, looking for anything that doesn't belong. So yeah, acute rejection is a constant threat. But, and this is the really good news, we have amazing immunosuppressant drugs that can basically tell that security team, hey, stand down, this new kidney is a friend. And most of the time, that's enough to calm things down and save the organ. But here's the catch-22. Those same drugs that protect the kidney, they also lower the body's overall defenses. It's a paradox. So what do you think is the #1 cause of death for transplant recipients? I bet it's not what you're guessing. It's infection. Isn't that wild? By dialing down the immune system to stop it from attacking the new kidney, you're also making the person way more vulnerable to everyday bugs, viruses, and bacteria. It's this incredibly delicate tightrope walk. You need just enough immunosuppression to prevent rejection, but not so much that you open the door to a dangerous infection. A constant balancing act.